Good morning. Let me share my slides. Okay, since this is one of the last topics that we will be having, then might as well we need to pay attention. Nawawala yung aking downloads. You have to review this one for your final examination. You just share it again. Okay. So we will be having the roles and functions of nurse in varied settings in the delivery of care to higher risk mother and child. So the areas that you will be assigned to, even if you will be dealing with the mother and the child, will be varied. And we will now be making a discussion on what are your certain responsibilities in here. So as the introduction here, pregnancy can be a very stressful time. Both women and the fetus could be at risk for complications. So this is now the reason why we are having a discussion on the different responsibilities of the nurse for you to be able to take care of the patient in the best way that you can. So you have to be observing the mother and the child. So what makes MCHN difficult is you both need to pay attention to both, sorry for the redundancy, to the mother and the child to minimize your complications. Actions to minimize your complications. You have to prevent disorders from affecting the health of the fetus. For example, if the mother is having a comorbid condition, and if you have assessed it and you have referred it, okay, to an obstetrician for you to be able to minimize the possibilities that the child will be affected too. Next is helping a woman regain her health as quickly as possible. So you have to help them in the recovery, okay? You have to help them in their recovery. And then helping a woman learn more about their illness. Like, for example, they have a comorbid condition or a complication during pregnancy, okay? Given the chance that they will have those, they will have to understand what to do and those things that should be avoided for the child not to be affected, okay? For the child not to be affected by these complications felt by the mother during pregnancy. Nursing role and nursing care during pregnancy complications. Number one, if the mother is having cardiovascular disorder, you should know the status of the woman before pregnancy, meaning how is that cardiovascular disorder affected the woman during pregnancy or before pregnancy and might affect the woman during pregnancy. And then exercise, why we will have to document the exercise. We have to document the exercise because we want to know if the mother could tolerate exercises or she may be she may be wanting to rest. Another is ask if she normally has a cough or edema. So if the cough is not treated by anything, then the persistent cough may be a sign that the cardiovascular disorder is not really doing well, and pulmonary edema could be one of the possibilities or the reasons. Or yes, fight for right-sided heart failure, assess liver size at prenatal visits, okay, because there could be a complication to the liver. So aside from assessing, then the doctor may order ultrasounds to check the liver of the patient, because a problem with the liver could lead to gestational hypertension and HELP syndrome, or your hemolysis, elevated liver enzymes, and low platelets. Nursing interventions, of course, monitoring the BP. Why? The elevation, the intermittent elevation of BP might not be good. Okay, so we have to refer to the doctor immediately if the BP of the patient is not doing well. And we have to promote rest, okay, 2 rest periods in a day. So for cardiovascular disorders, the most important for them is rest. Okay, they have to rest within the day because there are some patients who are suffering from cardiac disorders that even at rest, they may feel very, very tired. Okay. Promote healthy nutrition. When we say promote healthy nutrition, since they will be having a diet modification, what else? They may be having maintenance medication, then we'll have to discuss with the patient what are the things that should be avoided here. Next is educate regarding medication. Okay, you have to tell them that if it's a maintenance, it should be taken at the right time. Okay, same time each day. If it will be taken once a day, every day. Educate regarding avoidance of infections, since they may be prone to infections, and if you have a cardiovascular disorder, you're prone to infections. And if it's during pregnancy, that might complicate the pregnancy and even the put at risk, okay, the life of the newborn or the baby inside. Be prepared for emergency actions should there be complications during pregnancy or even during delivery. During labor and birth, you have to be very certain of the vital signs of the patient. Okay. You have to uh, be very particular with the duration, intensity, frequency, and interval of uterine contraction for checking of placental filling. Okay. You have to advise the woman. That's why I've told you before that a woman with heart disease should assume a left side lying position, okay, for better maternal or placental perfusion. And if the mother has a pulmonary edema, then you may have to elevate her head and chest, okay, for her to be able to breathe or to compensate with the um, burden of labor and delivery. If you have extreme heart disease, then you may need an oxygen. Okay, you may need an oxygen. Okay. And then mother should not push with contractions. Again, you should not be pushing with contractions. They should be required to um time it. Okay, they may have to wait for the go signal of the healthcare provider beside them when to push, because when you are giving birth, your cervix must be fully dilated and it should be effaced 100% for you to be able to push. Next is stool softener could be given or prescribed to prevent straining with bowel movement. So, because they don't, because we don't want them to be exhausted, then stool softeners must be given. Tell the mother that they could breastfeed without difficulty. They will be. You have to explain to them that breastfeeding will be done like the normal mothers could do, and Kegel exercises are acceptable, but for perineal strengthening immediately. Okay, but not so much on it because they will not be allowed to get tired. Also, ensure that she schedules a return appointment for postpartum checkup, okay, for her cardiac status if there may be a need to modify her maintenance medication. They will see if the pregnancy have complicated the cardiovascular disorder or it's just the same. So it's now a referral to a cardiologist or to a practitioner who understands the disease well. For hematologic disorders, okay, throughout pregnancy, the nutrition of the woman, like for example, folic acid supplementation should be given. Okay. They will have to be. Sometimes the doctor will increase the dosage of this folic acid, and should not the mother should not be taking iron supplement, okay, because of this the effect of iron supplement to the body when you are having hematologic disorders. Then the doctor will suggest that you will need to have this folic acid. Ensure that the mother is drinking at least 8 glasses of fluid daily, of course. Another one is you have to assess the varicosities of the mother in the lower leg. Okay, this might again complicate pregnancy and might lead to other complications. And then planning her rest period, how would she do at work? Okay, then you may have to talk to the mother with this one regarding this one. Fetal health is usually monitored by an ultrasound examination at 16 to 14 to 24 weeks for us to be able to know the earliest status of the baby inside the womb of the mother. for renal and urinary disorders, of course, you have to be very careful of monitoring the input and output of the patient, the increase of fluid intake, because you wanted to flush out the infection. And then you have to make sure that the output of the patient is amounting to 3 to 4 liters per 24 hours by putting an indwelling catheter for us to monitor really on this one. And you have to advise the mother to avoid immediately after sexual intercourse for us, for the mother to avoid urinary tract infections. And of course, urinary tract infections, again, is highly related to preterm labor, preterm babies. For this one, you will have to tell the mother to have regular antenatal checkups because of the possible effect of UTI to the mother, for the possibility of preterm labor. That is again another complication that we have to manage. So that is the reason why they have to have their checkups. And you have to control blood pressure. The diet should be low salt, low fat. And bakit low salt, low fat? We don't have to eliminate salt 100%. Okay, we don't have to eliminate the salt 100% because we have to bear in mind that this is also needed by the baby. Next is protein requirements. Okay, they will have to have protein, but it's calculated. And for those women who have CKD, they will have to be managed by low dose aspirin for the reducing the risk of preeclampsia. So you have noticed when we discuss about preeclampsia, low aspirin is also given a very low dose. Antihypertensive drugs in women with CKD is continued in pregnancy unless systolic blood pressure is consistently rising. Okay, so we have here to co-manage the mother, not only the nurse or not only the midwife or not only the obstetrician, but we may have or there might be a need for us to be able to refer this mother to nephrologist, okay, or another doctor who knows how to manage, or this not only we may need here an internist, a medical intern, okay, for the BP, and of course the co-management of the CKD. For respiratory disorders, the mother might need to have honey with lemon or lozenges for cold, but you have to advise the patient that over-the-counter medication should not be taken during pregnancy because there might be a need to there might be a need to ask the obstetrician if these are safely or could be safely taken during pregnancy. Advise not to take aspirin during pregnancy because it can interfere with blood clotting. Okay, and then a room humidifier. It might also be needed, okay, to of course moisten nasal secretions and help mucus drain. So we'll have to have a humidifier. This is very important also with mothers who are having post-nasal drip during pregnancy because sometimes because of the presence of estrogen in the body, the mother might be having recurrent allergic rhinitis or post-nasal drips. Use cold or warm compresses to relieve a sinus headache. Okay, this sinus headache could lead to other complications like ear problems. Okay, that might give a vague feeling to the mother. So you have to be able to assess this properly and help them manage this. For those with asthma, advise them to consult their primary care provider about safety of the medications routinely used to be certain with its safety during pregnancy. So you have to be telling your OB-gynecologist what are the medications that you were taking before pregnancy so that they could distinguish which are safe and which are not. And for those who have COPD, advised to have additional bed rest of fatigue and may need continuous supplemental oxygen during the day. So this one, aside from the COPD that is aggravating the pregnancy, we also have to take note that during pregnancy, mostly on the 36th 36th week. Okay, mostly on the 36th week, the mother might be having difficulty of breathing because of the enlarging uterus. So we have to manage this well for us to be helping the mother. Okay? Offer support at prenatal visits for smoking cessation. For rheumatic disorders, okay, for this one, for rheumatic um, arthritis or any rheumatic disorder, we have to tell the doctor what are the medications that we before that we were taking before pregnancy, and if we're trying to conceive, we have to tell the doctor that we are suffering from these diseases so that they may give you, or we have to weigh the risk and the benefit of taking your medications during pregnancy if you're having a rheumatic disorder. So it's not really easy to conceive or to get pregnant. You may have to have a review of the medications that you are taking. Women who take leflunomide, okay, must stop at least 2 years if you are uh, using this one um for your RA. So you have to be very careful. You have to be yung yung leflunomide kasi is a combination with other medication given for rheumatoid arthritis or your RA. Rheumatoid arthritis is a condition in which the body attacks its own joints. Okay, pag nagkukos siya ng mga pain, swelling, and loss of function. Um, yung talagang yung leflunomide is a class of medication called your DMARDs. DMARDs is disease-modifying anti-rheumatic drugs. Okay, DMARDs, DMARDs. We call them your disease-modifying anti-rheumatic drugs. Okay, so this one, okay, you have to, aside from the OB-gynecologist, you have to have a rheumatologist for you to be able to know the side effects and the risk of taking the medication during pregnancy. For GI disorders, of course, pinaka-importante dito yung fluid and electrolyte balance. You have to have adequate food and fluid, and you have to assess. Like you have to assess if the patient will be having other conditions na hindi natin nakikita. In hepatitis, bed rest must be promoted and encouraged to eat a high-calorie diet, preventing the mother from having hypoglycemia. Okay. So they may have to have a sugar because of the problem of the liver. Okay. So bakit tayo nag-hypoglycemia? Bakit tayo nag-hypoglycemia? Hypoglycemia in hepatitis. Isipin natin we have different types of hepatitis. Okay. Yung hepatitis A natin, hepatitis B, hepatitis C, kailangan nating ma-review yun, okay? Your hypoglycemia in hepatitis kasi, it can occur due to the liver's inability to produce or store glucose, leading to reduced capacity to maintain stable blood glucose levels, okay? If you have already that liver damage, so you have to have this certain medications, aside from medications that could be treating the GI disorder, but it could be medications for the hepatitis. Another one is for cases with appendicitis, syempre, they may have to have laxatives for them not to be able to strain during defecation, and they should be taken in it should be taken in consideration that the gravid uterus might be pressing the inflamed appendix and might be a predisposing factor to the rupture of the appendicitis. So we have to manage also the appendicitis. The doctor might decide on further evaluation. Okay. And of course, because of there's a possibility of rupture, then the operation might be needed. Okay, for this super inflamed appendix. For diabetes mellitus, a person with diabetes prior to becoming pregnant, she should meet with her primary healthcare provider because In diabetes, again, in gestational diabetes mellitus, we have the human placental lactogen that is causing the possibility of high blood sugar. So if you are already suffering from diabetes mellitus um, during before pregnancy, then you might have to check with your healthcare provider what to do, because there might be increased monitoring in all aspects, and most importantly to the lung surfactant of the baby. Advised to have a urine culture each trimester to detect asymptomatic UTI. Okay, as the increased glucose concentration in the urine may lead to increased infection or possibility of increased infection. And advised to undergo ophthalmic examination for the possibility of complications. And of course, the diet of the patient might be maintained. Okay, advised to have at least 30 minutes of walk daily. Okay, that is healthy for this diabetes. Okay, so because diabetes mellitus might be aggravated during pregnancy. So for the interprofessional care maps, it is a collaborative and shared document that involves a joint and an interprofessional team of professionals summarizing the patient's current and preferred situation, as well as professional goals and actions. So this uh, might be how would you deal with the disease of the patient, where to refer, who will be the doctors who needs to attend to the patient. Interprofessional care in nursing. So when we say interprofessional, here are collaboration of various professionals working with the families and the patient and the families. Actually, for example, for a certain patient, a pregnant patient might need an gynecologist, midwife, and a nurse, a nutritionist, okay, the diabetologist or an internist should there be complications. So meaning there are a lot of professionals who are suffering, who are managing the patient. Okay. So this one, for the clinician, patient, family care partners, we have here the health concerns of the patient. So what are the concerns of the patient? What are the manifestations of the patient? So what aside from the this one from the complaints of the patient, from the complaints of the patient, okay, we may need to plan. Okay, we will need to plan here. You will have to plan for the future result, okay, aligned with other goals, and then you have to decide. You have to include your reasons or your rationals why you will be doing this one, and you have to intervene. Okay, this one is when we try to act for the patient, and then reassess the patient. Okay, reassess the patient if the interventions given are um effective, and that could be leading to your evaluation, wherein you will be interpreting your assessment. Okay, so evaluation is interpreting your assessment after the intervention. So you have to know the condition of the patient, you have to plan, you have to decide what are the most important things to be done, and then you have to intervene. You have to intervene. And then after intervening, then uh, you might have to assess again the patient. Oh wait, let me just again, we are not just only assessing the mother, but we are also after the health of the child. In order for an interprofessional primary healthcare team function effectively, you should have one goal, okay? It should be having that one goal, and those things that you plan for the patient must be done with professional responsibility, okay? Professional responsibility. And once the team has identified programming goals, team members will need to identify what this may mean in reality. So again, if you have assessed the condition of the mother, it should be the goal of the team to give the best of care, okay, or their best ability, okay, to handle the patient. Benefits of interprofessional practice healthcare. So it helps to prevent medication errors, okay, because one may check on the other. improve patient experience, okay, because multiple practitioners or healthcare providers are acting or working for the care of the patient, deliver better patient outcomes because there might be scenes that might not be interpreted by the other healthcare professionals, that might be evaluated by the other. And then, of course, you will not be staying a very long time in the hospital. And it also helps hospitals to save money by assuring work flow redundancies, okay, and operational inefficiencies, because the other professional, okay, might be looking into the work of the other for the management of the patient. For interprofessional core competencies, organization. Okay, when we say organization or organization of the competencies, meaning you have to know that you have the certain competency, and you know what really is that condition of the patient that you will be dealing with. Okay, aside from this one, the values and the ethics and roles and of responsibility and responsibilities, very important. There should be congruency between your competency, your values, your ethics, and your the performance of your roles, because it will not be good that you are just competent, okay, that you don't have the ethics in there. Interprofessional communication, proper communication, telling the doctor what to do, okay, telling the doctor that these are your assessment, I should say, and telling the other members of the healthcare team that these are the things that you have assessed with the patient. And teams and teamwork, you should be working towards the betterment of the patient. And what is included in nursing care plan? There are a lot of variations or redo of the nursing care plan. Before we just have the assessment, planning, implementation, and evaluation, but now you have the assessment, diagnosis, expected outcome, interventions, rational, and evaluation. So you have this six, okay? You have this six, and it's difficult, okay? It will be more difficult to um do it because it has six already, but again, it is more detailed because after assessment, you will be diagnosing. This diagnosis is not the diagnosis coming from the doctor, but it is a nursing diagnosis for you to be able to know what are the things that you as a nurse might see to the patient, and expected outcomes, meaning what is your goal, and then you have to, or what is your plan, then you have to intervene, you have to implement your plan, you have to give a rationale to your plans, and then evaluate. So it has to be done correctly and systematically. So you now know that your responsibility as the student nurse or a nurse in the future with the mother and child does not end in knowing the disease or complications of pregnancy, the signs and symptoms, and the treatment, but you also have to collaborate with other members of the healthcare team to co-manage the condition of the mother, may it be a comorbid condition, a congenital abnormality, or anything that could happen in the entire pregnancy until the birth of the baby. So you have to uh, bear in mind that your responsibility is really wide. Okay, thank you and good day.